house.
Password?
Yes, it's hand, face, space, surface. Whether you are working, shopping, eating, or meeting, remember the password to protect yourself and others.
How?
The password, hand, face, space, surface, can help us take our lives back from
Coronavirus.
hand. Wash hands with soap. Face, wear a mask. Space, social distance. Surface, keep surfaces clean.
Issued in public interest by the Ministry of Health in collaboration with CIDES, LSHTM, with support from UK Aid and Unilever.
When it comes to radio, you are spoiled for choice. But there's only one station that reigns supreme. Hot FM, #1 for news and entertainment.
Hi, Grandma.
Wait. What's the password to enter the house?
Password?
Yes, it's hand, face, space, surface. Whether you are working, shopping, eating, or meeting, remember the password to protect yourself and others.
How?
The password, hand, face, space, surface, can help us take our lives back from
Coronavirus.
hand. Wash hands with soap. Face, wear a mask. Space, social distance. Surface, keep surfaces clean.
Issued in public interest by the Ministry of Health in collaboration with CIDES, LSHTM, with support from UK Aid and Unilever.
It's 11:33 on your hot station, #1 for news and entertainment. Good morning to you. Welcome to this special program that is sponsored by the Center for Infectious Disease Research in Zambia, simply known as CIDES. Now, you as a listener, I want you to pay particular attention to this show because we have hampers to give out on the show today. If I were you, I would stick around because I have 10 hampers to give out. It is possible to help take back our world from the coronavirus. Listeners, again, pay attention. We have hampers to give out. And today's program, we're basically talking about COVID-19. And my guest in studio is Tukia Kanguya from the Center for Infectious Disease Research in Zambia, CIDES, under the Social and Behavioral Science Unit. Tukia, great to have you on the show. How are you today?
I'm doing well. Thank you for having us, Flavor.
Nice one. How's the morning going? I mean, it's very cold today. Very, very cold.
Yeah, it's very chilly. It's been a very cold day. I think we've had like London weather for the past 2 days.
I haven't heard that in a long time.
Yes.
I mean, back in the day when someone tells you London weather, then you know it's really cold.
Yes, we have it in Lusaka now.
Yeah, nice one. Really nice. So, Tukia, kindly explain to us and the listener out there, that might be hearing of CIDES for the first time. Who is CIDES, which is the Center for Infectious Disease Research in Zambia, and what exactly is your mandate?
Okay, so CIDES, just spell it out, is the Center for Infectious Disease Research in Zambia. Mm-hmm. We are a local non-governmental organization that have really been a member and partner of Ministry of Health since its inception in 2001. And our mission and mandate as CIDES is to improve access to quality healthcare. And we're doing this through capacity development, through research, implementation science, and research programs that we do run in our communities. Okay. And as the Social and Behavioral Science Unit at CIDES, we really have focused on improving access to information on COVID-19, and we are an active member of the Risk and Communications group here in Zambia, and we've really been working on improving messaging on COVID-19 in the community.
Interesting stuff. There's a campaign that is going on, password campaign. Would you kindly tell us about the password campaign that has hit the airwaves in the past weeks and its significance?
Okay, so Flavor, really, if we are to beat COVID-19 here in Zambia, we really need to be very much aware of the steps and measures that we're taking in the community. Yeah. And this includes making changes to our daily routines. Yeah. So what we do on a daily basis. The password campaign really is a reminder for us as people in the community, for you and me, people in our communities, to continue to practice the measures and rules for us to kick out COVID-19 in Zambia. And these are rules that, of course, that we still have to maintain even after getting vaccination is one is the hands. So if you look at the campaign, it's hands, face, space, surface. So if we are focusing on that campaign, we're looking at hands. Our people in the community must continue to wash their hands to ensure that they are sanitized, they wash their hands. We need to continue to wear our masks. And as well as we need to continue to maintain social distance. So that's where you have the space. And as well surface, which focuses on ensuring that our surfaces are disinfected and clean. Yeah, so that's the password campaign: hands, face, space, surface.
Interesting stuff. In case you just joined us, I'm talking to Tukia Kangwe from CIDES. She's under the Social and Behavioral Science Unit. You and I are victims of COVID-19.
Yes, we are. We are
as
COVID-19 survivors.
We are.
Yes, indeed.
I'd like you to take us through your experience with COVID-19, you know, being a patient and surviving to where you are now. How was it?
I'll put it in one word, Flavor. It was quite a traumatic experience.
Yeah.
You know, we would see these statistics on MOH. I know I work for a health organization, but when you see the statistics, you'll be like, maybe I might get it, maybe I might not.
You know.
And I remember the week that I was, before I was diagnosed with COVID, to say I'm positive, I remember feeling really sick in that week. So it started as a headache, and I was just feeling weak in my joints. And I thought it was a flu and it would go away. So I'll just take my lemon and tea, and I really just brushed it off and I continued with my daily routines. And I think it was on a Friday, I really became down. And I remember that night my sister decided to say, no, Tukia, you're really down. I was shaking. My knees were weak, my joints were weak, and I started to shake. And she said, let's go to the hospital. And that's how we drove. It was quite late, about 21. And luckily, there were some people who were still testing for COVID at that time. Yeah. And when I got the result, it was, oh, you're positive, you have COVID. And my sister said, test her for everything. Test her for everything. And at least they also tested me for COVID as well. And once I got the news that I was positive, I think then it dawned on me like, oh, wow, COVID is real.
That psychological effect, isn't it?
Yes, definitely. And I think that's when the whole experience really started. And when we went home, we were told, okay, you have to manage this case from home. She's positive, but she's got mild symptoms, so she doesn't really have to be admitted, hospitalized. But still, of course, while home, I was isolated in my room. So that meant me spending most of the times alone. So I think those 3 weeks.
It's such a lonely disease, isn't it?
It is. I was self-isolated, and it was so lonely. And I think at that time, all I wanted was a big hug from the world. Absolutely.
How long did it take for you to recover?
It took about 3 weeks from the time I tested positive to the time I got my result, from the time I got negative. So it took about 3 weeks for me to get a negative result. And I think it was a long 3 weeks. I know people will be like, it was just 3 weeks, but it was the longest 3 weeks of my life.
Trust me, you can have everything at home. Your internet, you have your pay TV, you have everything. It's still not enough.
It's still not enough. It's not.
As a human being, you need to go out there and just see the world.
That's true.
Being confined to one place for 3 weeks is a long time.
Yeah.
Let's now talk about how you are protecting yourself from getting COVID-19, because they say the experience is the best teacher.
Exactly.
And it's also, fair to say we learned the hard way. What are you doing to protect yourself from COVID-19?
I think from the time I actually got my negative result, my sister has been calling me OCD, because
even that?
Obsessive compulsive disorder. And what I mean by that is I am sanitizing my hands every 30 minutes, every hour. So I'm making sure that when I'm in public spaces, the first thing I ask for is, do you have sanitizer? Do you have a hand basin where I can wash my hands? So I think for me, since reintegrating back in society, I've really mainly focused on really practicing our password campaign. And that's, of course, washing my hands, avoiding public spaces as well.
Yeah.
So I only go into the community when I really need to go there. Like I really avoid crowded spaces at all times, most of the time.
Really
and
nice.
we can see we are, of course, 1 meter apart here.
Yeah, we are.
So I am ensuring I'm not getting COVID again.
No, you're not.
Yes,
You're basically
yeah.
practicing what you preach. Have you been vaccinated?
Yes, I have.
What would you tell someone out there about, just how important it is to get vaccinated, or what would be your word of encouragement to someone who hasn't gotten the vaccine yet?
I think for my word of encouragement to those who haven't yet gotten the vaccine is stop believing these theories that are out there. I think we really do all need to get vaccinated. And I know there's this misconception to say, no, even if I get vaccinated, I'll still get COVID. But the fact is, those who get vaccinated tend to have a milder case of COVID-19 as opposed to a severe case. So I think my message out there is let's get vaccinated. And it's also a sign of you caring for the next person out there. Like, we have our elders, our loved ones. So really, if we do care about our elders and our loved ones, we should definitely get vaccinated.
With that said, what then is the password to help take back our world from the coronavirus?
So the password to help take back the world from coronavirus flavor is hands, face, space, and surface.
And guess what? We have 10 hampers to give out. We'll be inviting your calls very soon on 0974 870 877, 0967 877 447, 0950 955 877. Let me tell you what is in the hamper. I mean, because you just hear there's a hamper.
Yes.
So there's a cup, a t-shirt, hand sanitizer, a cloth face mask,
Yes.
and a bar of soap.
Wow.
How cool is that?
Very cool.
Very, very cool.
I'm hoping I also win one for
No,
myself.
you're not eligible. Sorry, Kia. You won't win. Let's go on a break. When we come back, we go straight to the phone calls so that you win those hampers.
Muli bwanja mbuya.
Embekeza. Chisinzi olo password yongerera mnyumba nicha.
Password mbuya. Password olo chisinzi. Manja pamesa pamalo pa vintu.
Ukuti usebenza ugula vitu ukuti uloenda kumsongano. Kumbukira chisinzi olo password. Chozi chingiriza na kuchingiriza kwa benangu.
Ni munjila bwanja mbuya. Chisinzi olo password ya manja pameso pamalo na pa vintu. Ingatitandize kuchosa moyo watu kuli corona. Manja ni kusambana sopo. Pameso ni kuvala kanyula kozi chingiriza olo face mask. Pamalo tinkalota la mukana. Pavintu tikinene pafupi.
Kusindikizidwa na chidwi pagulu na Ministry of Health kusebenza pamozi ndi Siders na ba LSHTM ndi tandizo kuchoka ku UKAID ndi Unilever.
There you go. So, those 10 hampers are up for grabs. Give us a call live on 0974 870 877 and 0967 877 447. So, here is what we've done. We have seen that the campaign is about hands, face, surface, and space, isn't it? So, we will basically play around those categories,
Yes.
and see what you're supposed to do. For instance, what are you supposed to do to keep a distance? You
Yes,
know, and then
yes.
give us the answer. There might not be a precise answer, but we'll see how close it is
Definitely.
to the actual answer.
Definitely. We want as accurate as possible to the answer.
Yeah. 0974 870 877 and 0967 877 447. You're live. Good morning.
Good morning.
Good morning. Who's this we're talking to this morning?
You're talking to Martin.
Martin.
Martin, which behavior are you picking?
Yeah.
Which behavior am I picking?
So we have hands, face, space, and surface.
And surface.
Pick one and we'll ask you a question on that behavior.
Okay, I'll pick the face.
The face. Where are we? All right. So if one is fully vaccinated and have a condition that weakens their immune system, should they continue masking up?
Yes, because the vaccine does not guarantee you that you're not going to get COVID. You still get it. So you have to continue masking up.
And the answer is
Correct.
yeah.
Congratulations.
Nice one, Martin. Can we get your full names?
Hankwebe.
Martin Hankwebe.
That's right.
Martin Hankwebe. Okay, so Tukia is just writing that down. Before we let you go, we just want to get everything right. We're done, right?
Yes.
Nice one. Congratulations, Martin. You can come to Hot FM and pick the hamper.
Thank you.
0974-870-877, 0967-877-447, and 0950-955-877. Good morning.
Good morning.
How are you today?
I'm alright, thank you. How are you?
Nice one. Who's this we're talking to?
You're talking to Felix.
Felix.
Sure, sir.
Which behavior are you picking?
The hands.
The hands.
Sure.
Mention the basics of good hand hygiene.
Frequently washing our hands.
One.
Frequently sanitizing our hands.
With?
Sorry?
With sanitizing our hands with?
With a hand sanitizer.
Yeah, but there's one word you missed there. Alcohol-based hand sanitizer. We'll still give it to you. Can we get your full name?
Felix Mlenga.
Felix Mlenga. Congratulations, Felix.
Sure. Okay, thank you.
0974-870-877. Remember that all of you are winning these hampers. You're coming to Hot FM to pick them. Just come with your ID, then we'll give you the hamper. It is 0967-877-447. You're live. Good morning.
Good morning.
How are you today?
I'm fine, thanks. How are you?
Good, thank you. Who's this we're talking to?
Aubrey.
So you know what we're gonna do? We won't ask you to pick any behavior. We'll stick to hands because we need to exhaust questions in that category, just so we don't mix things up. Yeah.
Yeah.
What is the recommended time for proper hand washing?
Pardon? I didn't get the question.
What is the recommended time for proper hand washing?
Apparently, there is no recommended time for hand washing. You should wash your hands frequently with the soap or hand soap and sanitize all the time with alcohol-based hand sanitizer.
I think I have to rephrase this. When you're washing your hands, how many minutes do you take washing them?
About 60 seconds or 30, between 30 and 60 seconds. 60 seconds.
To hear?
About a minute or so.
What do you think?
Well, 60 seconds is good.
It's good, actually.
But the recommended is between 20 to 30 seconds.
So 60 is even better.
Yeah, so 60 is even better.
You said your full name is?
Aubrey Lukama.
Aubrey Lukama.
Yes.
All right. Nice one. Congratulations, Aubrey.
Thanks so much.
0974-870-877, 0967-877-447. How many are those? 3?
We have 3 winners.
So there's 4 to go, right?
Yes,
there's
we have
7. Sorry.
7 more hampers to give away.
Good morning.
Good morning. How are you?
I'm alright, thank you. And how are you?
I'm good. Tell us your names and where you're calling us from.
Well, this is Precious from Mateo.
Okay,
from
Precious.
Okay.
Great.
So let's go to the face category, which is the behavior, right? The first question was answered already, was about vaccines. The second one is how should your mask be worn correctly?
Like you have to cover your nose, your mouth, and like it must be under your chin.
Ah, nice.
Nice,
How
perfect.
precise is that?
Very precise.
Nice one, Precious. What is your surname?
Mwanza.
Precious Mwanza.
Yes.
Congratulations, Precious. Come to Hot FM and get your hamper.
Thank you.
0974-870-877, 0967-877-447. I'm hanging out with Tukia from Siders, and we're giving out hampers because there's a huge campaign, that is going on, and you have to know about it, isn't it?
Definitely. We need to practice the password.
Absolutely.
What's the password flavor?
Face, hands, surface, and space.
I hope you don't forget.
Beat that. You're live. Good morning.
Good morning, Trevor.
How are you today?
I'm good.
All right. Who's this we're talking to?
Happy Nyasulu.
Happy Nyasulu.
Yes.
Let's go straight to it. We have the behavior in space and surface. Which one are you picking?
Let me get the surface.
Surface. The first question is, what should be done to surfaces which are regularly touched?
They need to be wiped with the hand with the alcohol based sanitizers or disinfectants.
Yeah, that is the word we're looking for. So, happy Nyasulu. Congratulations, my brother.
Thank you.
Nice one. 0974-870-877. Coming up at 12 is the menus. On the other side of that, you'll be hanging out with Double K on the Midday Express, your lunchtime ingredients. You're live. Good morning.
Good morning.
How are you today?
I'm fine, and how are you?
Good, thank you. What's your name?
My name is Lukeshi Kelly.
Lukeshi.
Yes.
So we'll stick to surface. And the question is, mention areas regularly touched that we don't normally pay attention to that should be cleaned and disinfected.
Okay, we can look at phones.
One.
Two.
Handles, car handles, door handles, toilet handles, toilet seats.
Yeah.
Yeah, I mean...
Correct.
What
You've given
more?
us more. We were looking for 2. You gave us 4.
How cool. Yeah.
Oh, wow.
So your name has been written down. Congratulations.
What's his name again?
Lukeshi Kelly.
Lukeshi.
Kelly.
Yeah.
Okay.
Yes.
Congratulations,
Thank you.
Kelly. How many of those to kill?
We have 6 winners.
6. So there's 4 to go.
4 more to go. Call.
0974-870-877, 0967-877-447. Where are the ladies at? I mean, there's only one lady on that list, if I remember very well.
Yeah, where are the women? Huh? We're supposed to be in a women empowerment when females lead.
Yeah. Good morning.
Hello, good morning.
Good morning. How are you doing today?
All right, sir, you're right.
Okay, who's this I'm talking to?
Christopher Mwaba.
Christopher Mwaba.
Yeah.
Okay, your question is, what should be done if one comes into contact with any kind of surface that has not been disinfected?
Come again?
What should be done if one comes into contact with any kind of surface that has not been disinfected?
That has not been?
Disinfected.
What should be done to that person?
Thanks so much for calling us in the interest of time. 0974-870-877, 0967-877-447. Good morning.
Good morning.
How are you today?
I'm good, thank you very much.
What's your name?
My name's Mwansa Jonathan.
Jonathan Mwansa. What should be done if one comes into contact with any kind of surface that has not been disinfected? Quickly.
That person will need to sanitize because there's such a surface which is suspected to be containing the virus.
Nice. There, we're okay. We're okay with that answer.
We
you said
are
your name
okay.
is?
All right, thank you.
You said your name is?
Mwansa Jonathan.
Mwansa Jonathan. Congratulations.
Thank you very much.
We can make 2 more calls before we get to the menus with Huge and Pampundo at 12. Like I said, after that, you will be on the Midday Express, your lunchtime ingredient, with Keturah and Kaliwa the Black Stallion. 0974-870-877. You're live. Good morning.
Hello, good morning. How are you?
Fine, thank you. What's your name?
Costas Chela.
Who?
Costas Chela.
Costas Chela.
Yes, sir.
Let's go to space, Costas. When must physical distancing be observed?
Sorry?
When must physical distancing be observed?
At all times and everywhere. It could be at work, at home. Make sure that you maintain social
At all times.
This guy sounds like he's looking at my script. Nice one. Did you write his name down?
Yes, Costa Sichela. Congratulations.
Yeah, congratulations.
All right, that's it.
Let's take in our last call before we get out of here. It is 0974-870-877, 0967-877-447. You can also give us a call on 0950-955-877. You're live. Good morning.
Good morning.
How are you today?
Hi, I'm okay.
Good, thank you. What's your name?
Muitwa Sydney.
Who?
Muitwa Sydney.
Sydney Muitwa.
Yes.
What should you do if you feel unwell or test positive for COVID-19 with minor symptoms?
Come again?
What should you do if you feel unwell or test positive for COVID-19 with minor symptoms?
Okay. You have to help people or ensure you have to go to the hospital to check on you, to test if you have COVID-19 or not.
You've tested positive for COVID-19, but you have minor symptoms, or you are you're not asymptomatic. What should you do?
Okay.
Thank you so much for trying. Let's see if we can squeeze in our last call. I'm just looking at time.
Yes.
And we have to make winners. Good morning.
Morning, how are you?
Good, thank you. Yeah, finally. Who's this we're talking to?
Sandra Matekenya.
Sandra Matekenya. So the question is, Sandra, what should you do if you feel unwell or test positive for COVID-19 with minor symptoms?
I should self-isolate at home.
Period. Simple as
Brilliant.
that.
Exactly.
Nice one. Sandra, congratulations. Your last caller. Thank you so much for calling. Come to Hot FM and get your hamper.
Sandra?
Thank you.
Matewa. What's the surname?
Matekenya.
Matekenya. Yeah.
Matekenya.
It's all good, Sandra. Come with your ID.
All right, thanks.
Take care. As we close, your closing remarks.
As we close, I'm just reminding all of you to get vaccinated and continue to practice the basic rules. Remember, it's hands, face, space, surface. Together, we can beat COVID-19 in Zambia.
Mulishani mama.
Kanya. Ishi widia kuingilila komunganda. Atemwa ilia mutira password. Lishi wishi
yangu password futi
kutila fe kuminwe pamenso panchende pafintu panchtole bonfiwa nangule shtefya kushtashta panchtole lya fimo nangu panchta shafidye ule ibukisha password pakuyichingilila nokuchingilila kona bambi